Next, we're going to look at a comparison between two different sports injuries that were treated by two basketball players, these being Derrick Rose and Kyrie Irving, two very successful basketball players in their prime. The first injury we're going to look at is torn ACL, left torn ACL, and that was done by Derrick Rose, which caused him to be out of any games for 5 months. He would have gone through extreme pain and swelling as the body would be going through the repair process, as we talked about in those introductory slides. And then the other injury we will be talking about is a fractured kneecap, which occurred in a game. And that happened to Kyrie Irving, and he was out for 6 weeks with no games. So a big difference in time frame as well, as we can already see. And his only started to swell when his compression tights came off. Now, first looking at what would have happened to Derrick Rose, he had to go under ACL surgery, which involves reconstructing or repairing the ACL by using a graft to replace the ligament. This would have been done very soon after the diagnostic, and he would have had to go through arthroscopic surgery, so that because it's easy to see and work on the knee structure, it uses small incisions in comparison to open surgery, and it can be done at the same time as diagnostic arthroscopy, which is just where you find out about the injury or damage. It's just a surgery that's done to find out about the injury or damage, and it may have a lot fewer risks than open surgery. So what happens in this arthroscopic reconstruction? The surgeon usually will take and make several small incisions around the knee, and he will use an arthroscope into one and a camera so that he can see what he's doing and use the camera to go onto the TV monitor in the operating room so he can begin to insert the graft. The surgery would normally take around 3 to 4 hours, and you would be in the recovery room for about 2 to 3 hours. And after the surgery, you will have to stay in the hospital for you don't have to spend the whole night in the hospital, but you do end up having to rest for several days because you feel extremely tired, and your knee will still be swollen because it will still be trying to repair the injury. And also you may have a lot of numbness around the incisions, and normally the doctors would recommend you putting ice to reduce the swelling. This is normally done just to restore normal stability in the knee, like at the level you had before the knee injury. But there is a possibility that it may not be exactly the same as it would have been at the beginning. The rehab program would be really long, especially for Derrick Rose, so that he can safely get back to the standard where he can play, like he used to before. It is quite a long process, and it could take a number of months just to get back the athlete to where they were before, which could obviously have a toll on Derrick Rose. So he'd go through a number of psychological factors, and these could be anxiety, isolation, motivation, or frustration, Of course, he'd be quite anxious because he wouldn't be able to tell if he would be getting back to his original state that he was in before. He would feel quite isolated from teammates as he wouldn't be able to go to regular trainings with them as he used to, and he is known for being quite close to his team. He may have it could go either way. He could have lack of motivation to train because he's in so much pain and doesn't see a very bright future. Or he may feel even more motivated to get back on the court and get back to his original state. And in this process, he will be frustrated with himself because he won't be able to do everything he used to be able to do. Now we're going to take a look at um, Kyrie Irving's fractured kneecap, where he was out for 6 weeks, and the swelling was quite big, but it started to swell only when his compression shorts came off. This process is a lot more simple than the ACL damage. Um, this normally patella fractures can be treated by wearing a cast or a splint until the bone heals, and this was exactly the case with Kyrie Irving, as he had a simple fracture, which means that um, one it's only one break in the bone or one small fracture in the bone, and the bone has not been displaced, the patella has not been displaced. Um, but if it were to be displaced and it was more complicated, then surgery would be needed to restore and stabilize the kneecap um, to allow for the return of normal function. Usually, um, these bones would normally take up to 6 weeks to repair, which was the case for him. So he missed a number of games in that 6 week period just to ensure that he was full to maximum strength. He would have had to take part in some rehab as well to make sure that he wasn't completely out of shape. And he may have used anti-gravity treadmills. He may have used quite a lot of things that would not put strain onto his kneecap, but still keep him in shape and do the best he could. But of course, he would have been restricted because of his knee injury. Psychologically, KI may have gone through a lot of stress as when this happened, this was in the finals, the NBA finals, at a crucial point um, in their series where he was needed as he is their starting point guard and one of their main scorers and players. So he would have been stressed out going into that locker room knowing that he wouldn't be able to continue and carry the team as he normally does. Luckily for him, LeBron James is on his team, so he won. Um, but in the recovery process as well, he would probably be quite motivated to get back on it as it was not that bad of a injury. Um, but it could put him down or put him back a little bit going forward. He would be frustrated because things will not be as easy as they used to be, similar to Derrick Rose. And he could probably blame himself as well at some point because he probably would replay the scenario over and over in his head and think of what he probably could have done differently to stop this injury from occurring. Now, there's a difference psychologically as well between both of these players. Um, Derrick Rose used to be one of arguably the top 10 players in the NBA. He was very athletic and he was an MVP. And, he was an MVP a couple years ago. But after his ACL injury, he never really stood out as a player. And now he's averaging average stats for an NBA player. He's not playing on a very good team. He got traded because he's not really been performing as he used to. And this is all after the ACL injury. And as you can see in the slide before, 2 slides before this is all his injuries. He's had quite a few. So he's probably quite worn down as a player. So now he's dived after the injury, whereas Kyrie Irving came back just as strong. And he's striving after his injury. And he's continuing. That year they won a championship. This year they're doing very well as well, and he's really improving his game still. Whereas Derrick Rose has kind of dived Kyrie Irving strived. Thanks for watching, and that's the end of my sports injury video.